We just want to move to where your body is comfortable at this stage, just to gently restore that movement, because something's stuck and sore, and the best answer is always gentle movement to your tolerance. So feet together, knees apart, and just dropping your butt back onto your heels and just moving backwards nice and slowly to where you feel comfortable. If that feels good, you want to stay there for a few reps, maybe a couple of minutes, until it kind of loosens itself off a little bit. You can keep your feet flat, drop your butt back onto your heels if your body allows that. Go a bit deeper if you can, and then move. Try not to hold a position for too long, because it's the movement that will nourish that disc and those nerves and whatever's jammed in that tight muscle down there. So just try and restore the movement as gently as your body will allow it. Then I would probably take the patient into a cat-camel. Find that neutral spine, breathing deeply all the way, because the deep breath will help you manage your pain, if you believe that. So find that neutral spot, tuck your bum under, your chin comes to your chest, come back to a neutral flat spine, and then drop through that pelvis. And oftentimes I find that patients that can't coordinate this movement will have a tendency to have more lower back issues. So if you've got no pain, my challenge to you is see if you can really get these movements coordinated between the cat and the camel. And you really want to incorporate the breath. Try and relax the spine in this position. Don't force it. It should be nice and gentle. But again, patients, in my experience, that can't coordinate that movement are generally going to have a tendency to more serious lower back issues. So try and see if you can nail that movement. Another exercise I like to give when things get really, really bad is to get patients onto your back. Your knees come apart, so as wide as you can get your knees comfortably. Grab onto your knees, squeeze your knees into your shoulders, and then extend that arm. So squeeze, and that should just give a little lift into that butt off the ground, which might be able to create a bit of space and provide you a bit of pain relief. So we're squeezing in, and then we're extending our elbows, feet stay together, and then the knees come up. Next exercise is to jump up on your tummy. Well, slowly move over onto your tummy. The key with this exercise is to squeeze your butt together before you come up. A lot of people will just push themselves up, but if you pretend like you've got a coin stuck in between your butt crack, you squeeze and you just lift, you might be able to get that little bit of extra movement, and then down. Squeeze your butt, make your chest as proud as your body will allow it, and then drop down. Squeeze the butt, so you're pushing your pelvis into the ground a little bit, and then lifting up, keeping that chest proud. So again, move to wherever you feel comfortable. Don't make it worse by the movement, but just try and maybe do 10 reps, 3 sets, whatever feels good for you. The last exercise I'd probably give to help patients in a lot of pain is oftentimes people are in this really curved position with that space in between their lower back. So I would just cue the patient to try and flatten that curve in your lower back, and then relax. Flatten that curve and then relax. So you're just trying to get that pelvis and that lumbar spine flat into the ground. Hold it there for a couple of seconds and then relax. So it's a really, really tiny movement, and oftentimes people find that nice and relieving for the pain that they're suffering in their lower back. And the final tip I'll give with really bad lower back pain is to try and breathe. Breathe really deeply into your diaphragm. Take the biggest breaths you possibly can, because that will also help with a bit of pain relief. So I hope that helps.